between those two things because oftentimes people will have problems with either one, the other, or both, and different things can be behind each one of those. So then how we address it would be different also. So because lack of sleep is really hard to deal with, people with insomnia then will tend to worry about going to sleep. And that can create even more challenges falling asleep because as you're trying to fall asleep, you could be worried about going to sleep. And then that worry is a vicious cycle that keeps you awake. And kind of what I try to tell people is it's not a coincidence that in some terrible situations, sleep deprivation is used as a torture thing because it can feel that way when you aren't able to get sleep and then your mind can't function and your body can't function as well as it normally would, sort of like a car that has no gas, oil, or water. It's just not going to have anything to go with. So then many people, because it is its own kind of suffering, will go to bed earlier or spend extra time in bed trying to get themselves more sleep, but that also can backfire. So it's one of those things where the harder you try with sleep, actually the less sleep you can end up getting, just because it can be this vicious cycle. So keeping that in mind with even some of the suggestions I have for sleep hygiene going forward is that the idea isn't to get it perfect or to necessarily do every single one of the things. Think about what works for you and then what doesn't work for you, and then making adjustments, keeping in mind that you know yourself best. So we know from research the different things that work, but all of you know your lifestyle, how you've gotten to sleep in the past, what does work for you and doesn't work for you. And so that's also an important part of making the lifestyle changes is balance. So difficulty both falling asleep and staying asleep can take a health toll, but it can also take a mental health toll over time. It's not a coincidence that the depression screener that you get when you go to the doctors has that, both falling asleep and staying asleep. Are you sleeping too much? Are you not sleeping enough? Is part of the PHQ-9, which is the screening for depression. Have you been tired or have you had difficulty focusing? That's all part of it because sleeping and lack of sleep can affect your mental health. Also, sleeping too much can. So once again, it's a balance because our brain needs sleep to rest. Fortunately, there's a lot of well-researched options to help improve sleep, and many of them are called sleep hygiene. It's helpful to know that the word is called sleep hygiene because it's an unusual thing. That's something we usually call, like, bathing is hygiene and brushing our teeth are hygiene. They call like insomnia and ways to address that as sleep hygiene. So if you're ever looking for resources, sometimes it can be a little more confusing. If you're not sure, you're going to get the most information if you do a search under the name of sleep hygiene. Sleep hygiene is similar to like preparing yourself to get ready for the day, like the brushing your teeth and combing your hair, but it's preparing yourself to go to sleep. And all the things that you can do to help yourself get a good night's sleep, much of those things you do before you actually go to bed. It starts much earlier than the day than most people think. So there are certain things that you can do. Is one of the sleep hygiene suggestions is to go to bed and wake up at the same time every day. That can be more challenging as you get older because you don't have necessarily your retirement, your routines that you did from when you were working. Your days might be broken up for different reasons, and you might have every day might look a little bit different. That is even more the reason why scheduling and training yourself to keep the same routine and schedule that works for you in the past and try to keep it every day, including your days off. So I'm not saying that everyone has to get up at the time they did when they got ready for work, when after they're retired, but finding a time to start your day and end your day is key, and keeping it in that same thing. That's why people who do shift work and things like that can have such a difficult time on their off days. The rest of the world is up during the day, and then when they work nights, they're sleeping during the day, and they're not able to really function in a way to keep their routine the same unless they sleep and wake at the same time on those other days. So shift workers have that additional challenge, which has helped us learn more about how important routine is for everybody, even whether or not we have shifts. So the other thing is to only try to sleep when you actually feel tired or sleepy rather than spending too much time in bed awake. If you haven't been able to get sleep after about 20 minutes or 30 minutes, get up and do something relaxing and then go to bed and try again. So a lot of times when people have difficulty falling asleep, they'll lay there and stare at the ceiling. There's the whole counting sheep thing and all those different types of like myths that we hear over the years. And if that works for you, that's great. But very frequently, if you lay there and you worry more about the fact that you're not getting to sleep, then it can actually ramp up your endorphins in your body and keep you awake. So if you get up and do something else, and it could be relaxing or it can be boring. Something boring actually can, all of us have been through it where you're doing something boring and next thing you know, your eyes get heavy. That's a real thing. Like,
I'll put it on the board.
yeah, yep. That's a real thing, and you can use it to your advantage. So the other thing is that bright light and the lights from screens will communicate to your brain that it's time to wake up. So people oftentimes have different lights on in the house, or they'll be using their computer screens or their phone screens, or they have the TV on before they go to bed. And it's really important to kind of be mindful about light. When the sunlight comes up, it signals to your brain that it's time to wake up, and it gets all of the chemicals in your brain reacting to that. And then you're able to get up. Well, you're basically telling your brain that it's time to get up or it's time to stay up by keeping lights on prior to going to bed. So I know a lot of people fall asleep with the TV on, and I'm not going to say that that's necessarily something you should stop doing if it works for you, because if you've done that your whole life and you don't have problems sleeping, then do what works for you. But if you're having difficulty with insomnia, that is one of the things they're recommending with sleep hygiene, is to not fall asleep with the TV on, especially with the lights and the blue lights and the screens from like the TV and things as well. So other things to avoid: doing things that are too energizing, like exercising right before you go to bed is not really the recommended thing, because you'll have all your adrenaline running and then you're trying to go to sleep. Getting into a stressful discussion right before you go to sleep, making a phone call or talking with somebody about your finances is probably not the best time. But it does happen, because sometimes people are so busy all day long, and then that's the only time you have, when you're getting ready for bed. But it really does interfere with your ability to then go to sleep if you're activating your brain on problem solving right before you go to sleep. Limiting the caffeine, coffee, tea, cola, chocolate, and some medications. Nicotine, so limiting those to at least 4 to 6 hours before bedtime is important, because they act as stimulants, and those things can keep you awake also. I would also go with the fact that they can make you need to go to the bathroom more often as well. And all of us know that if you have to go to the bathroom in the middle of the night, you're going to be awake to get there. So just something to keep in mind. Avoiding alcohol also. It's best to avoid at least 4 to 6 hours before going to bed. Many people will say that they feel like alcohol makes them sleepy and tired. And for some people it does. The converse part of it is that there's this rebound effect, that once the alcohol dissipates from your system and is filtered out of your system, not only do you oftentimes need to go to the bathroom in the middle of the night, but it can have a rebound effect where you wake up wide awake in the middle of the night and can't get back to sleep. And so it's really important to think about that. A lot of people, when I would talk to them um, through my work at the hospital, they would tell me, "Oh, it helps me fall asleep. It helps me relax." And then I'm like, "Do you ever wake up at midnight, 1 o'clock in the morning?" "Yeah, how did you know?" I'm like, "Well, that's because it's wearing off." And then you get this rebound effect, and then you can't sleep at all. So that's just something to kind of keep in mind is that the things that you do may not be immediate obvious that could interfere or help with your sleep, but sometimes they can happen in the middle of the night or later on. That's also a lot of information on what to do to help yourself and then also what not to do. Also, avoiding fluid intake before bedtime because it can lead to more bathrooms runs in the middle of the night. And if you have to go to the bathroom and you get up, the more times you get up, the more you interrupt your sleep, and then the less deep sleep you're able to get into because you have interrupted sleep. And then training yourself that your bedroom is for sleeping rather than other activities like watching TV, eating, or working. So if you're working in your bedroom or you're doing other things in your bedroom, like some people will have even like a desk in their bedroom, a small desk to the side, or different things like that. It's not recommended because you're training your brain that there's more than one activity in your bedroom that needs to be taken care of. And it can be really hard to like separate that. Even though like you feel like you can separate that, your mind, subconscious mind is still thinking about the other things and the other routines that you do in that room. So I know sometimes people can't avoid that where, if you like live in a dorm or you live in a shared space and that's the only space you have, but finding a way to contain that, like to close the laptop, to cover things up, to close your books and everything that are on there so that it looks taken care of rather than it looking like there's still work to be done, can signal to your brain that, you can move forward with peaceful sleep. In addition to improving your sleep hygiene, research has also found that cognitive behavioral therapy can target, it's called CBTI, and improve an individual's ability to sleep. So no one's fallen asleep yet on my talk. That's good. But CBTI is structured and it's evidence-based approach to helping individuals identify some of their thoughts and their behaviors and their patterns that fuel insomnia. There are therapists that specialize in CBTI. However, their programs are very limited. So frequently the doctors know that this is a very well-researched intervention for sleep. However, Stanford a while back only had like 1 or 2 fellows at a time. And it's a longer, like a 1 or 2 year fellowship. So that kind of gives you perspective of why there's not that many people out there who specialize in it. So as a result of that, and since it's a more recent discovery, the CBTI, from a research standpoint, is that they've started creating apps. And it's called DCBTI, so it's like digital CBTI. And people have been researching the apps also to see how effective they are. So there's a variety of different CBTI apps, and some of them people might find helpful or not. There's also online programs and various things like that. So that's some of what I shared in the paper, the handout that I did. Just so that you guys have some ideas and some options out there. The way that CBTI works from a therapy standpoint is that, show you here in the next one. It explores the connection between the way we think, the things we do, and how we sleep. So during treatment, a CBI trained provider will help you identify your thoughts, feelings, and behaviors that contribute to the symptoms of insomnia. Thoughts and feelings about sleep are then examined and tested to see if they're accurate, while behaviors are examined to determine if they promote sleep. So cognitive interventions, cognitive restructuring, attempts to change inaccurate or unhelpful thoughts about sleep. So here's an example. People will often tell me, I'm worrying in the middle of the night about this different problem or that different problem, and I can't sleep. Well, very frequently, 2 o'clock in the morning is not the best time to problem solve. So, and when I say that, it's obvious. Most people think about that. However, it still ends up being like, until you point that out, people still will worry through the night very frequently. When you bring it to the forefront, then people can see what their thoughts are, and that, yes, it probably isn't the best time. And so that's kind of the reality testing that a therapist can help you with, is that, and if it's not the best time, then how can I do what's called thought stopping and stop that thought? So then some of the interventions that I will use is have a worry box next to your bed and write down on a sticky note what that might be, that you worry, or a list, and then close it so you can go back to sleep, because probably you're going to solve that problem better at another time. Another intervention is schedule your worry. Well, you know that if you know that 2 o'clock in the morning is not the best time to solve a problem, when do you have the most time to solve problems, and when is your better time to do that? If it's 10 o'clock in the morning, schedule your worry. At 10 o'clock, you give yourself 30 minutes to worry and problem solve. And at the end of that time, your time is up and you'll have to reschedule the next day. But giving yourself a structure to your worry, trying to make a worry go all the way away is really a whole different project. But just trying to contain it to a structure is a lot more doable for most people. So that can help people shift it from being in the middle of the night and realizing that that's not going to be the best time to solve it, to another time that's more productive. So that is one of the ways where somebody who is knowledgeable about CBTI can help people to identify what might be contributing to their thoughts and their behaviors. Their thoughts being, oh no, I got to worry about this because the money problem that I have. And then, oh yeah, that's not the best time for me. The bank's not even open and there's nothing I could do about it. And then I'll think about that tomorrow at this time. That's the whole process of kind of reality testing, reframing, and changing your behavior to a time of the day that's more doable. So that's where the thoughts and feelings about sleep are examined and tested to see if they're accurate, while behaviors are examined to determine if they promote sleep. Cognitive interventions, and that's cognitive, an example of like cognitive restructuring. Behavioral interventions focus on reducing the stimulation before bed, creating routines like relaxation techniques to help healthy pre-sleep habits. So finding things that are relaxing, and everyone is a little bit different as what works for you, but those things can help like get you ready for sleep. Even if you're not like necessarily in your bedroom or it's not your bedtime, starting a little while before sleep. So one of the examples is we had our daughter. The closer we noticed when she was little, the closer we got to bedtime, the more ramped up she got because she didn't want to go to bed. And so the more ramped up she got, the less likely she was to go to sleep. So we tried like the bedtime story, but she knew, she loved her bedtime stories, but she knew that meant like bedtime, which she also didn't want to do. So then it would be like more books, you know, she tried to pile on the books. So pretty soon we said, we changed it to quiet time. You have, you know, 30 minutes of quiet time before bedtime. And that was enough to kind of put a buffer in there to wind down, because to her 30 minutes was a long time when she was little. So then she didn't feel like she had to like rush us with these strategies to stay awake in the same way. It kind of put this buffer in between that gave her some time to kind of decompress. And that really actually helped. I mean, it's different for everybody. You have to try different things, but having like 30 minutes to an hour where you can do some kind of a winding down that works for you. And once you find that, doing it as often as you can also help. And then providers who do CBTI can also help with helping you identify the different things, and so can the apps and the books. Because truthfully, when I said is 2 o'clock in the morning the best time to like solve a problem, everybody knows and laughs. It's just you don't think about that. So things like a book or the apps can help you identify which things, thoughts, and which kind of things you have going on, and then you're empowered to make the changes. Research has shown that the apps can be helpful. The difficulty, though, is that you don't have the support of another person. So some of the things that would be involved is if you were to see a therapist that was able to call things out and kind of help guide you through it, you would have the support. The apps can still be helpful, but it's important oftentimes to have support for new goals. So keeping in mind that they are limited because they don't have that compassion that you can get in another person. So some other relaxation techniques that are commonly taught are breathing exercises. This can be taught in CBTI, and it also can be on some of these apps or in books. The exercises typically involve taking slow, deep breaths, and research has demonstrated non-focused breathing can increase slow heart rate and breathing and reduce feelings of anger and depression. Muscle relaxation, progressive muscle relaxation, where you tighten the muscle and then you relax it, can also be helpful because frequently people don't realize that they're tense. So as you go through your body, the way that progressive muscle relaxation works is that you tense in the muscle and then you release it and try to relax it as much as you can. And you start like from your head to your toe or from your toes up, whichever way you're most comfortable with. There are some times when people don't realize they're tense and they go to tense their muscle and then they realize it already was tense. Yeah. So that is how, in some ways, I feel like the progressive muscle relaxation helps you realize, wow, I was really tensing here or there already. And it kind of identifies those places. So it helps you learn how to better relax your body. And then meditation can be helpful because you're training your mind to relax, and meditation practices like the various mindfulness practices and attention to movement and yoga and Tai Chi, those things also can help your mind wind down and help you relax. So the big question is, what about medication? A lot of people see all the over-the-counter things and they're like, why can't, like, I just use that and then I don't have to do these different changes. Lifestyle changes have less side effects traditionally. Doctors are more likely to recommend that as the first line because a lifestyle change doesn't depend on a pharmacy. It's less likely to have side effects, and research has shown that it can really work. Oftentimes people are stuck in a certain pattern when they're having lots of insomnia or difficulty falling asleep or staying asleep. And so once they make some adjustments, they can make a difference. The use of sleeping pills may have health risks. They can lead to dependence, and the biggest thing that concerns me is that they can lead to fall risks. So frequently, I had different people say, I don't understand why I've been taking this so long, and now my doctor says no, not to take it anymore. And then the doctors sometimes don't have enough time and appointment to really explain how worried they are about the fall risk. And fall risk is real. And so if you're drowsy, people will say sometimes, well, I'm not drowsy during the day, but if you're drowsy in the middle of the night and you get up to go to the bathroom and you have one of these medications on board and you fall, like that's a really not a bad scenario. And if we can avoid it, we'll try. So one of the best ways to avoid it is to try these other things beforehand. Therapists are unable to prescribe medications. They're not medical doctors. And so if you are interested in medications, whether or not you're taking an over-the-counter or a prescription one, it's good to talk to your primary care doctor or talk to a psychiatrist or an NP or a PA, because they'll know more about medications, including the over-the-counter, but they'll also be able to tell you if those over-the-counter medications are going to interact with something you're already taking or they'll know your medical history, so they'll be able to say if it's recommended or not based on your own health history, which that's something you can't get obviously from an app either. So to wrap it all up, lifestyle changes, improving sleep hygiene, therapy, and CBTI are often the first treatment that most providers suggest for insomnia. If you're not able to find a CBTI trained therapist, you can look for a therapist that is knowledgeable about CBT, cognitive behavioral therapy in general, and talk to them about how you would like to use it to target your sleep. Because as a customer, when you go to therapy, you're a customer. So you can talk to the provider about what your goals are, and somebody who's knowledgeable about CBT should be able to help you apply it. If you suspect you have underlying health issues, or if you continue to have difficulties falling asleep, it really is important for you to follow up and see your doctor. There are some health conditions that can contribute to insomnia, and that is really important to have that addressed too. And then for some information, additional information, you can also look at the American Board of Sleep Medicine, the Association of Behavioral and Cognitive Therapies, and Society of Behavioral Sleep Medicine. And if you type like insomnia and sleep, any of those, frequently those will all come up on as choices. Just make sure if you go to look at any website, it's something reputable rather than like some off link that trust yourself if it doesn't look like it's a legitimate link. And then there's some more in here. So I checked all of these right before. These are some of the recommendations that we give out at UC Davis for resources. All of the links work, except I think the UCSF sleep disorder needs to be updated. So I'm not sure what they changed there. I would take the prices with a grain of salt, because as we know, everything changes with prices pretty daily. This person at the top, this Brandon Peters, was one of the first few people who did the CBTI program at Stanford. And because there were so few people doing it, he ended up he wrote a book. So he has a couple of books out now on addressing insomnia. And then also he has an online program. So those are those first few ones, because it was one of those things where he was only one provider at the time, and then there's so many different people needing it. He felt this was the best way to get the information out to a broader amount of people. So those are the suggestions that are out there. Does anyone have any questions or anything else to add? Because I'm sure that it's not a new topic.
So I use CBD product, and I told my primary stuff. It helped me get to sleep. It works really well. I do all the other things, but that really is
Makes a difference for you. Yeah.
Can you repeat it for Zoom?
Huh?
He said he uses a CBD.
So
CBD.
there's a strain of marijuana that is used for sleep by a lot of people.
Yeah, repeat it with a Zoom.
Yes. So he says that there's a CBD product, a marijuana product that he's been using, and he's talked to his provider about it.
So it's a tincture rather than smoking.
A tincture, yeah.
Tincture.
Yeah.
Works really good.
Yeah. I think it's good that you've talked to your healthcare provider about that as well.
And
Because
I
that's
ring track my sleep, so I can tell if I don't use it, such commitment.
Yeah, so he said he uses an oral ring to track his sleeping, so that helps him know, and he can see the difference. So yeah, there's a lot more tracking devices now that can help you with tracking your sleep. I think the watches do it now, and there's different apps that can also analyze it. So people are a lot more aware, I think, of their sleep in a way that they haven't been in the past, which is a good thing. Anyone else?
Does that help with pain?
With pain?
I mean, in my age group, I would think rather than mental distress keeping me awake, it would be more physical.
That's true.
And
Yeah, it can be both things, and addressing your pain can help, obviously, you go to sleep, especially if it's keeping you up. But that would be probably from your healthcare provider.
Because I would think in certain age group,
Mhm.
if there would be different causes that would be more prevalent in causing the insomnia or the sleep disturbances. For me, I'm just uncomfortable a lot of times there's not, I can meditate or
Mhm.
do a lot of things, but
Mhm.
I'm still not comfortable.
Yeah, and that's really where healthcare providers are. It's important for them to
Yeah.
help address that. Because I think that, yes, there can be different things in different age groups that are more prevalent. But as people age, if they're more worried, if a certain group is more worried about money and finances and things like that, then that's gonna
true.
keep them awake. If you have health conditions that have you up going to the bathroom, or medications, the side effects of some medications have people going to the bathroom, quite a bit, that's going to interfere with your sleep. Also sleep apnea and obstructive sleep apnea. And that's why following up with your doctor is so important, because there are sleep studies that can evaluate if you have sleep apnea, because if you stop breathing intermittently through the night and you don't know it and that doesn't get addressed, that's going to affect you're not going to go into the deep sleep because you're waking up. So you'll miss parts of the sleep cycle. So I really feel like as we age, there's so many things that actually can contribute, and pain is also one of them. Yes, very much so. Also muscle cramping. Some people get muscle cramping because of their medications or because of some sort of thing that goes on neurologically with their muscles, and restless leg syndrome, that's a real thing too. So that's a really good point. I think there's a lot of reasons that as we age, we can't fall asleep the way we could when we were little kids, and our bodies like were, in better shape, and the world was not as complicated to us as it is now.
You have a newborn that you know what sleep deprivation is.
Yeah. Yeah. But you watch the newborn sleep, a lot easier sometimes. Not always. But
Yeah, colicky baby is
yeah.
torture.
But usually that's because there is something going on, right? And it helps if you can address it. So I would say that it's can very much be a health thing that's really important to follow up with. I know a lot of the doctors ask, and that's also why it's included on some of those screeners, because it's also very much a quality of life thing too. Like, does any of us feel good in the morning when we wake up and don't get a good night's sleep? Like, it affects the whole rest of your day. I'm sure the students know about that when they're pulling like all-nighters and things like that. So, yeah.
There is one thing I recommend, or at least people who like struggle with like sound.
Mhm.
There is a company called Oslo, and they have their own earbuds that play relaxing sounds. And it's really helping relax and fall asleep.
So there's noise counseling earbuds.
Yeah, the noise counseling, and they like play their own like relaxing sounds. And
Okay.
really,
And it's called Oslo.
yeah.
Awesome.
Okay. So also for the people at home. So one of our students was mentioning that OZLO are earphones, earbuds
They're earbuds.
that are noise canceling and that also play their own relaxing music, and she has found it helpful.
Slow sleep.
Wow.
They're expensive.
Yeah,
Yeah.
you could also subscribe to it. It's cheaper.
It's a discount if you subscribe to them. Yeah.
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 Ask.
I do think that's a good point, though. There are some headphones and earbuds and things that if they work for you and they help cancel out distractions, those might be some options. I know some people use the eye masks. And looking at your room and your environment to see what might help or not help. Sometimes people get the blackout curtains because the light comes in certain times and wakes them up. And I think that's really, really like important to kind of check out your environment and see.
Yes.
Yeah. Yes.
Those are my
Those
go-tos.
Like, need their eyes covered. Like,
Uh-huh.
I like it dark and then I like my eyes covered, so like, I used to just put like a blanket or a pillow above my eyes,
Uh-huh.
but I've upgraded to a weighted eye mask.
Weighted
It is
eye mask.
So nice,
Wow.
and it has like a lavender scent to it too. That's really nice. I
Wow.
would recommend it.
Close that.
Yeah.
And it's cheaper than the $300
Yeah.
earbuds.
It also occurred to me, our skin is thinning, right?
Uh-huh.
And our eyelids are also thinning. So
Yes.
If there's light, we
Mhm.
get more light reaction even with our
Yeah.
eyes closed.
Yeah. No, that does make sense.
Now.
Yeah, so,
Things to make sure everything's
Mhm.
dark.
right. Yeah. So it was mentioned that there are weighted eye masks that can also be relaxing because they not only block out the light, but they have like a soothing weighted feeling in there, cheaper than earbuds. And then it was also mentioned that as you get older, if your skin thins, then potentially your eyelids are thinning as well. The skin around your eyes are thinning as well, and potentially that would let in the light more. So it's even more important to kind of scan your environment and see where the sources of interfering for your sleep might come from and find ways around that. And I think it also speaks to the fact that everyone's different. So also finding what works for you, really not overlooking that part that it is customizable. Mhm.
Temperature.
I have my friend come over 5 days, so they can get some because of the light. I don't know.
Uh-huh.
Already.
Uh-huh.
They asked me, why is it whenever I come over to your place, I need bigger books? I mean, too. I think that's something that would help other people.
Yeah.
Are in, I don't know why.
Yeah, so I actually have heard that the color of light. So it was mentioned that the color of light in one of our students said in her room, people come over and to visit her and they feel like they are relaxed and want to fall asleep. And she was wondering because her color of light in her room is like orange, like an orangey, and she thinks that that might have part of it. And I know I've heard things about the different types of light, because light is like on a rainbow, and the frequency of light, depending on the color, is different. So I think that is a really good point, is that there are probably some colors and some lights and that could be more conducive. And there's so many options about that now. There's different types of lighting and different types of bulbs and different things. So, I think instead of like trying to make it hard and a project to do all these things, that speaks to the fact that try to make it fun. Like, what can you do to make things more relaxing and spa-like in your bedroom that helps conduce sleep?
Let's do it.
Yep, go ahead. So
Oh,
we have one more thing that,
yeah, one more thing. So I'm participating in a study. It's for 65 to 95-year-olds. So if you're not met, sorry, it's.
Kevin?
You're not met.
why don't you come,
Would you mind
well, come over
speaking
here
into the microphone?
because there's a lot of people listening actually.
Oh, all right.
So Kevin also has an announcement he'd like to make.
Yeah, so I'm participating in a study through UC Davis for 65 to 95-year-olds. I have the flyer here with more information. And basically, what you're going to be required to do is eat goji berries. That, 5 days out of 7. And the reason they're doing it is they think that goji berries increase a enzyme in your eye and promote better eye health. So they're doing a study, and they have 30 patients. They'd like to have 60. So I'm here to evangelize it, and I've got the flyers here. If you qualify for the study, you make $200. So in gift cards, Target or Amazon. That's just an aside. But basically, one of the things they do is they do a very thorough eye exam. So you have a baseline. So if you develop problems in the future, you have a very thorough baseline to compare to your doctor does, and that'll help with the diagnosis and that kind of thing. And basically, the study is 90 to 180 days of eating goji berries, and then they do some blood samples at the beginning and the end, and the eye exam at the beginning and the end, and then they're going to publish the results, which you will get an answer to. So if you're interested in participating in the study, I think it has just a couple of visits for eye exams and that kind of thing. And then participating in the study, and all you have to do is eat. So here's the flyers, and I'll put them over there.
Okay, very
Okay.
good. Thank you.
Thanks.
Okay, that's it, folks. Thank you.
Okay.
My son.